in the Democratic Republic of Congo, nurses wait for members of the public to show up for a free vaccine. Hours go by, sometimes days, before a patient appears willing to get inoculated. Only about 5,000 people out of 90 million have taken up the offer of a vaccine. Among those unwilling to get vaccinated are health workers, doctors and nurses who don't trust the vaccine.
We don't know the real truth about the vaccine. Our government isn't very clear with us on who should be getting it, elderly people or us. We just don't understand what is in it and who it is for, and until they provide us with some clarity, I refuse to get inoculated.
Fear of the vaccine appears to be spreading faster than the vaccine itself. Since the Ebola outbreak, there has been a general distrust in the country among health workers, with people fearing that they spread viruses instead of protecting the population. Add to that videos online like this one, where a French doctor last year suggested that vaccines should be tested on Africans before being administered to Europeans. Faced with such skepticism, the government is giving away 1.3 million doses of AstraZeneca vaccines it received last March to other African countries. But they too are struggling to inoculate their populations. In South Sudan and Cameroon, only a fraction of their populations is vaccinated.
There are many rumors and much misinformation online, but in regions where most people don't have access to the internet, that alone doesn't explain why so many are not taking up a vaccine free of cost. The UN says governments aren't doing enough to accurately inform their citizens and make doses readily available to them.
In Uganda, where there's only enough doses to vaccinate 1% of the population, President Museveni is leading by example. UN officials admit getting people vaccinated in months in countries where it is taking decades to get children inoculated against measles or yellow fever is a challenge.
Well, actually, while getting vaccinated might seem to be free of cost, it's actually not that simple. There's a journey to get to the health center. You either need to pay for transportation, so that's going to be your bus fee or your taxi fee, or you have to walk. So there's a cost.
And few vaccinated. The fear is the situation can only get worse. Nicholas Hawk, Al Jazeera.